Hello, I'm Melissa Lindley with Willamette Valley Hospice. Welcome to the second session in our series on Untangling the Challenges of Aging Vital Decisions. In celebration of National Hospice and Palliative Care Month, we offer this series of webinars to our community free of charge. This month in all sessions, we are focusing on a theme of the vital decisions we may all need to make to stay safe at home. We appreciate you joining us today. My name is Melissa Lindley with Willamette Valley Hospice and Palliative Care and the moderator of today's session, Options for Senior Living Communities, How to Choose. A special thank you to our sponsors who helped to make this series possible for all of us. Title sponsor Call Your Law and corporate sponsors Salem Health Foundation and Oregon Oncology Specialists. You can still register for the third session on Medicare and Medicaid if you have not already done so by going to wvh.org/calendar. Please feel free to invite your family and friends to participate. Any donations that are made throughout this program will be gratefully accepted and go to our community bereavement program. You can visit wvh.org for more information on all of our programs and this series of Untangling the Challenges of Aging Vital Decisions. You will receive a recording of today's session in the next few days, along with the survey. We would appreciate any feedback that you have on the program, the format, and topics. Questions will be answered at the end of the presentation, and any that we do not get to in time will be addressed by email to you. So enter your questions into the chat box to the right on your screen. There's a little circle with a question mark, so you can enter your question there at any time during the presentation. We have a lot of information to cover, so if we don't have time to get to your question, make sure that you email your questions to us so that we can be sure to address it. And we will include an email address in that follow-up email when we send you the recording. Cheryl Sordorf is our speaker for this session. Cheryl is recently retired, but before finishing her career by working in hospice care, she was an administrator of senior living communities and is here to share her vast expertise with us. So thank you so much, Cheryl, for being with us today. I'm going to turn it on over to you now.
Thank you so much, Melissa. Good afternoon, everyone. Thank you for coming and participating in this. Also, I didn't want to forget that tomorrow is Veterans Day, and I'm wishing all of you a wonderful day. I hope there's great activities, and thank you for your service. There's a lot of information around looking at places to live in senior communities for sure. And I'm going to touch on some definitions of things that wouldn't necessarily be the first place that you're looking unless something has happened to your physical well-being that dictates that you must go into a much higher level of care. But we will take questions on that. But we're going to start out with independent living communities. Most of you know what that is, I'm sure. You may have already started looking and asking questions. But with the independent living communities, they're kind of a good step for not having the burden of home ownership. And typically the residence is established on a monthly rental basis in a independent living. They have fully equipped apartments. They have cottages and studios and 2-bedroom units, and they may be rental assisted or market rate depending on the community. And I'm going to encourage you, and I'll say it several times, please take your questions with you, have a little pad and pen. Make sure that your questions get covered. It's critically important that you remember that and don't get it confused. It's like looking for any home. You try to remember if a certain place had something that you thought you remembered, and then you go back and find out, no, it wasn't that. So please take good notes and review those notes when you're home with your family and friends who might be helping you. There's amenities and hospitality services such as housekeeping, linen service, transportation, and social and recreational activities. Some have an additional charge. Some may not even have some of these activities at all. They do not provide assistance with activities or daily living and personal care. So independent living is just that. It's very independent and you're living inside of a community. They provide meals. So again, if you're confused, ask questions, write down what they say. Adult care homes or family care homes are private residences that provide a home-like setting for 5 or less residents. The caregiver may perform several functions such as personal care, housekeeping, activities, and group meals. There are 3 levels of adult foster care home licenses. The classification system is based on the level of care the adult foster home may provide to residents who live in the home, as well as the experience and training of the providers and their ability to assist residents with personal hygiene, mobility, eating, dressing, toileting, and behavior management. Residents may require very light assistance or may be dependent with several care needs. It is best to ask individual locations for their specific policies and license. Very, very important. CCRCs, you've probably heard the term, it's continuing care retirement communities. This can have a lot of questions because you're not necessarily all in one building. There's multiple buildings and independent living. You might have a duplex somewhere else, and then the main buildings might have memory care and skilled nursing. There's a continuum of care where you normally start out in independent living. There's assisted living and residential care and skilled nursing all on one campus. This allows individuals to live within the same community as their needs progress through a spectrum of care. They typically offer the full selection of amenities associated with retirement living. An endowment fee, in addition to a monthly maintenance fee, can be expected. Traditionally run as nonprofits, if you are looking at a for-profit, ask how a potential sale of this property would affect your contract. This is a critically important point that I didn't want to forget to bring up because it catches people by surprise or they don't remember what they signed, but there's some very strict protocols and processes that occur that are necessary for you to understand. So please be aware and ask if this property should sell, change ownership, how would that affect my contract? Because your contract is there to cover the levels that you may need to progress to. Assisted living communities are state-regulated rental properties where 6 or more residents may reside. Care assistance is available, including medication management, bathing, dressing, toileting, and eating. Apartments must be fully self-contained private living units with a lockable door, a private bathroom, and kitchenette facilities. The fee is regular monthly rent along with additional fees for specific services and amenities. Additional living communities are best suited for individuals who want to remain as independent as possible and who are able to direct their own care. I suggest that when you're looking at assisted living communities, you make sure and eat a meal in the dining room. Ask about additional charges for each level of care that you may need. So assisted living doesn't mean carte blanche, whatever happens or changes in your physical needs, that they just take care of it. You need to understand and know that there can be levels based on what your needs are. And that is a different charge and can go up in a month. It can change in 2 months, depending on the needs of the resident. If you are a pet owner, make sure you understand the rules and that you are able to care for your own pet. The people that work in the community are not there to take care of your pets. See the laundry facilities, know what they are, what they do, what they cost, and are there additional charges for someone who you may need to help you at any given time. Don't be afraid to ask questions, and again, write down the things that you think about and make sure before you leave your visit that you are covering the things that have popped into your head as you're walking through the community. And I would suggest you can have family go ahead and do a little research for you, but always the person or couple that's going to live in that community should come and tour and meet the people. What's the feeling they get? And again, they should eat a meal and understand how the meals work and what is served. Memory care and dementia communities offer and provide care for residents with Alzheimer's disease and other dementias, and it's in a home-like environment. These communities must receive an endorsement and are governed by additional regulations that are specifically intended to support individuals with dementia, including a secure building that alerts staff if the resident tries to exit the building, and a secure outdoor area that provides outdoor freedom safely. They also have interior finishes that are non-glare and well lit, and visual contrast between floors, walls, and doorways. This is important for the resident to easily navigate in the building. Excuse me. Alzheimer units must also have programs which include gross motor skills, self-care, social, craft, sensory enhancement, and outdoor activities based on the ability of the resident and residents. Residential care facilities provide housing and support services for 6 or more people that do not require 24-hour nursing care. Pricing can vary greatly depending on the level of care, provided the size and amenities of each apartment. Different apartments have different things that are geared towards what that resident's needs are. They're typically in a home-like setting and may range from a shared bedroom and common bathroom to private apartments and with kitchenette and private bathroom. Monthly fees vary greatly based on unit amenities and care services. Many residential care facilities specialize in caring for individuals with Alzheimer's and dementia. And the last one I'm going to mention before we talk a little bit more in depth about these, skilled nursing facility. They're state licensed and they provide safe therapeutic environment for individuals who require rehabilitative care. Skilled nursing facilities offer a 24-hour skilled nursing care and medical services by licensed nurses and support professionals. This is the highest level of care that can be provided that is not hospitalization. Additionally, these nursing facilities offer residents some planned social, recreation, and spiritual activities. So here are some questions that in our previous Untangling sessions before this year, lots of people brought up and stated when we had person-to-person, face-to-face sessions. The basic one was, well, what do I receive for my monthly rent? And, you know, that's a big, broad question. So make sure that the individual things you're needing answered and want to know about, that you have little checks to put on your page that say they covered that, or you ask a question and take them to that specific area. There's a number of things, you know, obvious things are the meals, 3 meals a day, and depends on the level of care and on the exact community that you're looking at. If you want to know more about the activities, I suggest you observe them when you're in a community and see how the people are interacting and how many people are attending that, and how happy they are at being able to do those activities. Do you allow pets, and are there breeds that are restricted? This is important because sometimes that's a surprise. And if you find the community that is the right fit for everything, except they don't allow pets, or they have restricted breeds and it happens to be one that you have, it's important for your family and you to discuss this and come to some type of an arrangement for the pet. Is there a deposit, and when do we get rent increases? Yes, there are rent increases. It usually happens annually. Is there an additional fee to park a car full time? There can be. Some communities really don't have the space to allow too many people to have a car. Now, in independent living, you're going to see that a lot more with people having their own cars. In assisted living, not so much, but don't be surprised if they just can't have everyone park their car, and they have a bus service. So make sure you ask specifically about that. How often does it go? How does it work if I'm not just going shopping, but I need to have someone be able to take me to the doctor or to physical therapy. So it's very important that you understand those things, because it's a real surprise when you find out you can't. Can a family member or friend spend a night with the resident in their apartment? Sometimes that is pretty strict, and sometimes they're more than happy to allow that. But you want to be sure, and if you get sick, you want to know that a family member could be there for the night for you, whether it's a cold or the flu. Do you need renter's insurance? That can vary by what the community says to you, but if you have a lot of belongings, collectibles, anything like that, and you're living where you can have those, you want to make sure, very sure, that if something is stolen, and it rarely happens, but you want to know that you're covered. The rent does increase annually, and I can't say what companies might do that more often than annually, but it's normally annually. Are the med techs, the people who administer your medications, are they certified? Did they get good additional training to be certified in making sure that you get the meds you're supposed to, that there's no mistakes, how they are inventoried in the med room is critically important. And ask, if not, why? Why is there nobody certified? The nighttime would be when most people have a concern for it. So ask your question, give them the opportunity to explain to you, and they can show you where the med room is. You can talk to a med tech, and so you understand how that works. If I have to go to the hospital, who notifies my family? Who notifies my emergency contact? If I need rehab, how long will my apartment be held for me? Very important question. And you don't want to find out an answer that isn't acceptable to you after you've had an accident or something that took you out to the hospital and then to rehab. Please, please, please make sure you understand the answer to that question. What would make me go to a higher level of care? Critically important. Sometimes things change, things happen when someone has gone into the hospital and then goes to rehab. It doesn't go as planned, it's taking longer. You want to make sure that your loved ones or your designated person that's watching over you from a healthcare perspective stays in touch with the community. Don't make assumptions about what's going on. And the community should really stay in contact with the family. So absolutely ask those questions, and don't be afraid to ask in the middle of what is going on if things aren't progressing as quickly as you had hoped. Can I use marijuana products? That is the number one question oftentimes when people come into communities. They have been using them for medicinal purposes. They had a doctor prescribe for them to use a certain marijuana product, but it's real important because people who are administering meds or caring for you must know that you have those products and you're using them, and you do need to get it approved. So don't make that assumption again by just simply saying, well, I know, but they're legal now. These communities belong to a much larger organization. They have a company and regional directors and people who are overseeing all of these things. They need to make sure that people are following the law and the rules of that particular organization. There's lots of liability, lots of legal things. So make sure if it's not in the contract or addressed somewhere that you understand the answer to that. Do you have a waiting list? Every community is different, and many times they have so many people wanting to fill a vacancy that they don't have a waiting list. Some may have a waiting list, so it's not carte blanche across the board. So ask, don't assume. Do you have a community fee or an entrance fee? And what is the purpose of it? This is real critical for those of you that may work in a community to be able to answer that well and completely for people, because they don't understand or know or have never experienced the things that happen in a community and the costs that are associated with everything provided. So give the community the opportunity to respond to that and give you an answer that you understand. It may not be the answer that you like. And remember, you're researching, you are visiting, you have other places that you can also go see and ask the same questions. So based on the answers that you get, again, write them down. Very, very important, because you want to understand that. And many people don't have the community fee. They can't afford it. So again, it depends on if you have done research and been directed to Medicaid communities or not. Whatever the circumstances are, you want to be sure that there's a thorough understanding of what they provide and the rules. Community fees are different for every community. Sometimes you'll see them doing a special and they're waiving the community fee. So don't assume everyone's doing that, but be sure and understand completely what it is, what they're doing, and do they ever waive them again? I mean, they may not, and they may not be able to answer that, but please ask and write it down. Everybody who's in your circle that is looking and reviewing the properties with you and for you need to understand that. I have met with many families where one or two of the family members did not hear the same thing that another one heard. They're mad because they didn't think there was a community fee. You just want to be very clear on what's there and what you have to do in order to register and move into a room. I want to say for our veterans, make sure if you're helping a veteran or you are a veteran, please go to your Veterans Administration and make sure that you know what kinds of things you might qualify for that would really be helpful to you in an assisted living situation. They have different programs that you might qualify for. Nothing's a given, and it's slow. I will tell you, it's very slow, but you should get what you deserve. Absolutely, you should get what you've earned. Does the community you're looking at, and this would mostly be independent living and assisted living probably, do they allow you to have a weekend stay as a single person or couple? Is there the ability for you to meet residents and just absorb how the community culture works and some activities and actually staying in an apartment and seeing how that works? It's not an unreasonable request. I don't know what communities across the board easily do that. Sometimes they are full. They're tasked with getting their apartments full and having a full census. And so they may not actually have something available to let you stay there for free. If you're not in a hurry, maybe something comes up and they can do that for you. But if it's available and you can do it, that's a really smart thing to do if you're apprehensive at all about moving into a community. Northwest Senior and Disability Services is a wonderful resource, and they can answer a lot of questions and help people navigate through needing assistance of some sort, financial assistance. They can answer questions and they can give absolutely great direction on where you can go to understand that and get that answer. And find out if there's something more you didn't realize that you could do. So CCRCs, just quickly, an additional, some additional information. One of the pluses they talk about is the friendships and the relationships that you develop, because you're there and you are spending time in activities and things, and based, especially when you start out in independent living. And so there's not an issue, if you will, when one of you or you as a single person need to now move from the independent living into assisted living. So that is something that you, even if you're good and healthy now, you don't want to have a surprise. Stay on top of if there's any changes or who you should go talk to if you have a concern. I'm just worried, what if something changes for me? And how does this work again? Tell me how I move in and tell me what it costs or doesn't cost or what's included, because it can be somewhat confusing. You don't want your residents in CCRCs constantly worrying about what might happen to them. The whole idea of that is they shouldn't have to, that it's smooth and they work with the family, but they are designed to cater to seniors at all levels of care needs. And it's possible to move into one when you're a little further along on the needs scale. You don't have to start out at the independent living level, but many people do early on. They may sell their home that allows them to go into independent living. I'm not going to talk about financial things today when it comes to that, but I would say that's a huge, huge piece that you need to understand when you go to talk to the community, go on a tour. You really want to understand those financial specifics. One thing, when you lose your spouse in a CCRC, at least you hopefully have been there for a little while and you have some good support and you already have a friendship base. You've already been participating in activities, and it can really be helpful to you in the grieving process, as well as them providing help with the grieving process. You want to ask other residents how they've liked living there, specifically what do they see themselves living there for the rest of their life. This is a huge commitment, and you want to feel that you can live there the rest of your life, even if you progress with your health. Are these the type of people you could see yourself living with? How do you feel in general as you look in the dining room? How friendly were people to invite you to be at their table? And what do they say about the community and the support that they get? Can you envision being friends with these people that you're meeting and seeing? And what sort of activities are available that appeal to you? Make sure that you're putting some thought into that rather than just shaking your head and going, oh, okay, there's a lot of things to do. And these are good questions, even in assisted living and in independent living separately, if they're not in the part of a CCRC. So, assisted living, that seems to be one of the most important levels that people are looking for. They find that they wait maybe a little too long, or something has changed recently that require them to have some assistance. The family can't do it anymore. They want them to be safe. and assisted living seems to fill the bill on that. So it can be much more affordable than a long-term in-home care or nursing home care. But if you need nursing home care or long-term care, remember that is not work in assisted living. So be sure that you're getting good answers, that maybe you work with someone who knows those answers, that helps people find these communities, goes on the tour with them to visit them. There are several organizations that do this, and they're very, very helpful. Assisted living communities can average for 40 hours of care in-home care can average about $4,000 a month for 40 hours of care a week. Assisted living is often one of the more affordable and convenient options, and your loved one must not need medical supervision. Yes, in assisted living, there is med management, and the meds are not in the person's apartment. They are kept centrally, and they bring them to the resident however many times a day that resident needs their medication. A big question is, how are the levels of care assessed in assisted living? And some go on a point system. It's based on how much care you need. There are levels in assisted living with things that, little things with daily living activities. If a resident doesn't need specialized care, then you can fully expect that they won't pay as much as someone who does. And if your loved one's needs change during their time in a senior community, the monthly cost can be expected to fluctuate. Facilities provide a detailed list of pricing and levels of care, and both at the time of move-in and annually, or if requested during a care review. So they give care reviews with the family and the resident and someone on the staff. It could be a nurse, it could be a main caregiver, it could be the community director or administrator. But again, that's a session. You want to make sure you come with your questions so that you understand who's supporting them, and that you feel that they have fairly changed in assessing your loved one. Other things that affected is floor plans. How close are you to the dining room? That's a big one. Lots of people want to be close to the dining room. And how close are you to the elevator? Those are several things that are considered in the price point, and they may not have one available at that time for you to be close to something. And another key question, please, please, please ask about the staff to resident ratio, especially in assisted living and memory care. You want to know how many residents this person is expected to support and help during the day. And of course, that's going to depend on the level of care they need, especially in memory care. So ask about it. It's not a question that's taboo. Ask so you know, and be very realistic about the needs of your loved one. Do they really need more than you're saying because you just want to get them in here? Or do they not need very much care? They really don't at this point in time. Just be realistic so you get a realistic answer, and be fair to the community. But they do have tests, easy tests that they can test the person on some basic things that would help them determine what they need. Remember that assisted living residences are still businesses, and they have a lot of financial pressures. And so it's very difficult when you go and ask if you can negotiate your rent to be lowered. That doesn't happen very often, and I'm not going to speak for the communities on that one. If your family isn't bound by a time constraint, waiting to move one into an assistant care community might be either a slightly lower monthly payment or financial perks like waiving the community fee. It's easy to get overwhelmed when you're looking for the comfortability and safety of your loved one, and it hinges on this big decision. Before looking at potential facilities, it's best to have a plan of action. So many people go, okay, they're excited, they want to go, and they haven't really talked to their loved one about it. They just take them and they bring them into the building, and they're looking around like, what is this? What's going on? That's really a bad foot to get off on. You want to have talked to them about it maybe days or weeks before you take them out to meet people that work in these facilities and the things that they offer. And if they're scared, or it looks scary, or it just doesn't feel right, you probably should come back. You dip the toe in the water, and you need to go spend a little more time talking about it, because it's not fair. It's really, really not fair to the resident, potential resident, to not have given them some kind of idea of what you're doing, what you're looking for, what's important to them. What do they think that's important to them? And sometimes it can be very basic, simple things. And can I have my own furniture? Those kinds of things, my own bed. Those kinds of things are very, very important to them, and should be. I'm not going to go into nursing homes and skilled nursing facilities. That's a whole nother session, but it is important. And again, it's no different going to one of those when you're having to make that decision, and you most of the time didn't think you were going to. Things have changed. So look at your list, look at things, start a fresh page, asking questions within, because it's different. It's different than having activities that are for everyone, music programs, that kind of thing. It isn't that they don't have some of that, but it's very, very different, and this is a big change. I'm going to close with letting you know that some people are looking to be able to cover the costs of this, and it's really important to them. And renting the home that the potential resident lives in is a possibility if your family can afford to cover the costs of going into a community and get paid back when the home sells. So there are a lot of ideas and things, and these people that can take you on a tour can help you find the communities to go look at. They can answer some of those questions for you and help you with the questions of what to ask. So thank you for spending time with us. We are so happy to be able to provide this for you and give you enough information that you may have tons more questions, but we will be happy to answer them, as Melissa said, and help direct you on to somewhere that you can get your questions answered and take your tours and feel comfortable with finding the right place for your friend or loved one. Thank you very much.
Hey, Cheryl. Melissa here. Let's get to some questions. And just to remind all of you listeners here today, thanks again for being with us. Please drop your questions in the Q&A, and we'll try to get to several of these before we end our session today. The first one, Cheryl, that came through is a question about asking you to comment on privately versus corporate-owned facilities. So I'm thinking they're getting at, you know, some facilities, especially adult foster homes, might be run by an individual person or family even, versus maybe larger facilities or care communities that are owned by a large corporation, some of them national even, right? So could you comment a little bit about that and maybe, you know, how they might differ, as well as any particular questions folks could ask?
Sure. One that's owned privately may be much smaller than one that is owned by a corporation, and there's not multiple properties necessarily. Sometimes there's 2 or 3, but they sometimes appeal not only to the family but to the potential resident because they feel warmer. They're usually in a home atmosphere, not a big building. They make them feel that this isn't so intimidating for the resident, because many times the future resident is very intimidated by what they see or what's going on. And they should smell good. You should smell the meals cooking because it's a smaller atmosphere. They have their own bedroom. And it's really like living with a family. So if your loved one would love being in a bigger atmosphere and loves the feeling of chandeliers and that kind of thing, that's great too. Or they want something much newer and more modern. Those are things to ask yourself what they want, because don't answer it as the baby boomer child, what you would like when you're looking. Make sure that you know what your parent or grandparent would really like.
Great point, Cheryl. And we should probably mention too that some sort of seemingly larger facilities, sometimes that's the only one that a group owns. And so it might even be a nonprofit. I can think of one CCRC here locally that's a pretty large community, but it's also a nonprofit. And so you have to ask those questions, don't you? Because sometimes it's not obvious how the organization is run, who it's run by, whether they own properties in multiple states or whether they're a local company that just serves our community.
Absolutely.
Let's get to this next question, which is also important. And Cheryl, maybe you have a better idea about this, but this person's asking, what is the current market status of availability? So are there more openings due to COVID restrictions? Are there less? How is that looking right now? Things have really changed in care communities over this last year and a half, haven't they?
I have talked with many communities and just checked in with them to find out how things are going. Some of them, it really impacted them negatively as far as losing census, and they have some openings. Others quickly have been filling them up, having people come in and inquire and choosing a room and getting them situated in their community. It's really depends on if it's meeting the needs of the people looking, if they feel it is what they need, and they are asking better questions. And that's why I'm always saying ask, write down the answers. because they're very knowledgeable. They're reading more articles on the internet, under the company's website, to be sure that they're getting the right one. But I can't point blank just say everybody's having a census problem because of COVID. It just really depends on the company and the community, how that's being played out. And unfortunately, many of them had a lot of deaths. And so that contributed to having more rooms available.
Great point. Everything is so individualized in this time of life, right, for folks, and then
Yes.
also for each care facility too. Well, we have one more question here, and it's such a good one. This person's asking, can an adult foster home take care of me if I'm on hospice, or do I need to go to a continuing care community?
Oh my gosh, great question. Yes, an adult foster home, it's your home. Hospice goes to your home, wherever that may be, whatever that may be, because they're coming in to care for you and provide the medications and do the things that help with your comfort, and make sure that they get to know the staff quite well, of course, because it's a much smaller situation in adult foster home, but you don't have to move that person at all. Only if for some reason the family feels it's better, or they want to take the person back home to their house. But hospice goes where the patient is, absolutely, and you can live in the adult foster home.
Cheryl, that's such a good question. I'm so glad you answered that. I also want to just mention my own grandfather actually had Alzheimer's disease and lived in an adult foster home and was able to live there and received hospice care there from Willamette Valley Hospice until his death. So certainly, on the other hand, my dad lived in a CCRC and received hospice care there during the COVID shutdown, unrelated to COVID, and died under hospice care there at a CCRC. So all of these different types of care facilities we have provided hospice care in all of them, haven't we? So we
Yes.
we're very skilled here, and your hospice team is very skilled at working with the staff of whatever kind of care facility in which the person is living.
Yes.
We've seen it all.
Yes, absolutely. Absolutely.
So there's one more question here that snuck in. Let's make sure we get to it.
Okay.
This person, Marcia, wants to know, how long does a resident usually stay in a facility?
Well, that's a very open question. It depends on the facility, the level of care. Each facility could give you their numbers, if you will, on length of stay, and also on deaths and the things that may have contributed to people leaving. Most residents I have experienced, if the facility is meeting their needs, their health hasn't really changed, but the facility is meeting their needs, they want to stay. They develop friendships. They like the food. The things that are important to them are being met. So I think that it's important to note that people will move if in fact their needs aren't being met. If their health is changing, that the level of care in that community can no longer really care for them the way it's needed, the family decides, I just don't feel that you can offer the care. I think we need to look at moving to a higher level. The doctor, all those people have input to help them determine if they want to leave. But I can say in the past, buildings that I have administered, we had an average of 2 to 3 years in most of the buildings. It was a good long time, and we had many who had lived there 8, 9, 10 years in independent living. So there's no cut and dried thing, but each community can sort of give you an idea of what that has been for them.
Great point, Cheryl. And I'll just add in also that my own grandmother lives in a CCRC, and she's lived there for 23 years.
Yes.
So,
and
so
that's
it really
the idea
can
of
vary.
a CCRC. Yep.
Right. She started in independent living, and of course now is receiving more care in her mid-90s. But at the same time, I think, like you mentioned, if someone is going to perhaps a rehabilitation facility, on the other hand, they might be going post-surgery just until they can get back to their assisted living or their own home. You know, sometimes there are temporary stays or even respite stays if someone is caring for a loved one at home and just needs a break. So that's a whole different scenario too.
Yes, and that's the goal. If you can get someone back home, because most people will tell you they want to go home. Now, some mean the community they've been living in, they're perfectly happy. But if they were in a house that they owned or living with a son or a daughter or someone, their goal is to get back home. And sometimes that's the biggest hope that people have, is to be able to get back home.
Right. And so, you know, in some circumstances, folks might live in an assisted living or CCRC, need to go to rehabilitation for a while, and then move back to their home.
Absolutely.
In that independent living or wherever it was after their rehab. So that seems to be the end of our questions here, Cheryl, and we're coming up on our hour anyway. I just want to thank all of the folks that tuned in today, and thank you to Cheryl for sharing your vast expertise with us. A reminder that you will get a link with the recording. You are welcome to share that with your family and friends, so to start these kinds of conversations. And appreciate all of you for tuning in to Untangling the Challenges of Aging. Don't hesitate to contact us if we can be of any help. We'll hope to see you again soon. Thank you.